Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hana
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin. Welcome to Healing Through Dentistry podcast. Today, this episode is shooted in Mexico. We were visiting a friend for a couple of days, and we would like to talk about how dentistry is becoming a medicine and future of dentistry.
Welcome to another episode.
So we have just come here for a couple of days because we went to Boston to our lectures with Professor Garatti, who is a leader of dentistry, which is returning the dentistry within the medicine field, and how we see in data how much the body is connected to the mouth. So it's not anymore separated like we used to have past decades. He is gathering lots of data to support how much it's connected. So
yeah, I'm excited to be part of that community as well, because it's just so nice to be in our professional home where people are same-minded and where they do realize that dentistry is no longer mechanical, but it is a biological process. And we deal not only with the materials, but we deal with the biology in the first place. So in this course, we are focused especially on bone health. So Professor Garatti likes to call us a bone doctors because he is aware that mouth is not separated, and the bone health and the bone vitality and the no presence of inflammation does influence a body a lot. Vice versa, if there is a silent inflammation in your jawbone, it can be after tooth removal, it can be connected with your root canal treated tooth, it could be connected to a trauma. You could have had an accident and you can have a hidden inflammation in your jaw. You might not be aware of it. And so I think that's where it comes to us, dentists, and we like to call ourselves Eva health focused, right? Yeah. Rather than biological or holistic.
Yeah, I like that. Health focused regenerative dentistry, because that's what I would love for the entire sort of field of dentist to refocus, because past decades we were focusing a lot in general on restoring beautiful smiles. I think, and I believe it's part of it, to have a beautiful smile, but I would like to just focus more for regenerative health focused dentistry.
Yeah, because it all comes to, our bodies and intelligence of the bodies, because if there's no
silent inflammation,
things which are actually draining us down in terms of immune system, nervous system, then the body is okay. But obviously if we do have to deal with metals, like certain materials, that's why we always just say that materials matter, because it does really matter what you put in your mouth. So materials, so if there's metals in your mouth, or even amalgam fillings still, or silent inflammation in terms of a jawbone inflammation or root canal treated teeth, which are harboring so much of the, bacteria, then obviously the body cannot deal or function that well as if there wasn't any of this. So we see that really clearly when
we do with the community of dentists from all around the world. So we have now, these days we're gathering with the colleagues from States, but before we were gathering with colleagues with all around the Europe. And the same thing is
the
underlined.
Message is the same.
The message is the same. The chronic low-grade inflammation really impacts your health. And it's the low-grade or, silent inflammation, hidden inflammation. Most of the people, they don't even know there is one. So, there's big transformations in clients. If you support the body, if you support their biology, And if you clean the infection very well, then you see the ability of the body to heal so well. Over the time, it doesn't need to be immediately. Well, sometimes we are so impressed how the body heals overnight on the dental chair. But I would say it's like reprogramming your body, because if you imagine you have silent inflammation there, let's say that tooth, root canal treated tooth, for a decade, for 10 years, then the body needs some time to restore, repair, readjust, recalibrate. I like that recalibration word because it's basically what is happening. So you see over the time of few months how the health is increasing in these clients.
Yeah, it's always a process. It's beautiful when it happens right away, which does happen, but definitely not all the time. It's usually a process. And I like that you said, Eva, when you support the body, it's not only removing the inflammation. Obviously, it's the key, and that's why we're here for, to make sure that we remove the silent inflammation and clean the area so there can be new angiogenesis, basically new vessels, reconnecting to the meridian, reconnecting to the pathways, nervous system, immune system, energetic system as well. So everything can heal. But also, I like when you said, Eva, support the body, because it's also our kind of duty almost.
It's a teamwork, I would say. So one part is us, and the other part is the other side, the client.
Exactly. That's the client. But our duty is to pass over the message and the knowledge that as a client need to have a certain nutrition and certain supplementation, enough sleep, enough hydration, etc. So we always say the mindset is really important, the emotional state as well. So nervous system is really important to balance it. So I like that you said that, Eva. And what I really liked to observe this time, because we were supposed to, all of us, create a presentation about our cases, and some people were sharing their symptoms as well. And it was very interesting to see how there's like a common theme where there was a lot of people with, a presentation on molars, upper molars. And upper molars, why do we see them quite a lot? Is that because first molar is the first one to enter after the baby teeth.
Yeah,
right?
they're coming through at the age of 6. So that's why there are issues likely to be, because you have an amalgam filling, mercury filling, you have the filling, then you have a root treatment, and then you have inflammation infection.
Basically, it's because you've got it in your mouth for the longest.
Yeah.
But anyway, I wanted to say a different thing. I wanted to say how it was very interesting to see how all of the people who were talking about the upper first molar, sharing that their clients have problems with thyroid gland, because that tooth is connected, according to traditional Chinese medicine, to a thyroid. So I've had a client who had thyroid gland nodules. She hasn't had a balanced hormonal thyroid hormones as well. There was a person with hyperthyroid,
autoimmune condition,
diseases.
And, after removal of amalgam filling, the levels of 1300s of TPO, which is like the antigen for like the marker you would see with the autoimmune condition, it dropped to 50, which is a normal level, which is fascinating how quickly the body can adjust within 3.5 months. But there is other, we have clients who have cramps within the period, like menstrual period, and it disappears as well. So it's just releasing the body of something we don't even know it's there. Most people, they would not be aware of an issue unless they would have a dental practitioner who is aware of this connection. And that's why I think we have started this podcast, we started this journey. That's why we are going to shoot by Old Dentistry documentary, because I believe the information is the key, and we are in the time where the information matter. Same time there is AI, so we just kind of losing what's true, what's not true, where the information come from. So basically we would be telling you only what we see with the client. So I feel that's always the evidence when you see the client story. So I would like to just talk about client stories more and document what we have, because documentation is a key too.
So yeah, I think key message from this podcast or sharing is just check whether there's any, if you do have any symptoms, check if there's any stuff being done in your mouth. It can be fillings, it can be metal fillings, it can be root canal treated teeth, it can be tooth removals, extractions, but also it doesn't necessarily need to be that. Like in our case, we haven't had extractions, but we both had CSRs, meaning covered socket residues slash cavitations, and we went through the surgery as well because the issue has happened around the butt of unevolved tooth. So check that as well. It's probably what we usually do in initial assessment with our clients. We do take 3D scan. You are not able to see none of this in a 2D image, which is only 2D, two-dimensional. You need to have a three-dimensional image. And also what we are learning right now with Professor Garatti, he's got a new technology software called Visiogenics, where we are even more able to see the hidden infections, inflammations.
I like to call it biomapping because it's exactly what you do. You're just scanning upper jaw and lower jaw for hidden silent inflammation, and it's scanned by the team of great professionals, which is fabulous. So then you would be able to schedule the treatment according to priorities, according to this biomapping. So
so that's one key message. Check what you've got in your mouth. But also the second one would be when you remove the hidden source of inflammation, then be aware that the body can really have a new breath. Like you're giving your body a big favor, because then it can regenerate and can connect to its natural ability to heal itself, which is very important. Okay, so I think that was for today, share of the day. And we will see you in the next episode.
Take care.
Thank you for joining us on Healing Through Dentistry podcast. We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile.
Take care,
and we will see you in the next episode.